Hi, I'm Jessie Blake. I'm the Vice President of Clinical Operations for MHN, which is Health Net's Behavioral Health Administrator. I will be walking you through our behavioral health services. In January 2021, Health Net launched Canopy Care HMO, a product that exclusively utilizes the Canopy Health Network to give Bay Area residents more choices and greater value for their health care. This new health plan features a broad network of doctors and hospitals and is ideal if you live and work in the 9-county region. With Canopy Care HMO, providers have the freedom to help their patients find the right care across the Canopy Health Network. This ensures that members are provided with the right care through every stage of life. Community physicians and high-quality medical centers are the foundation of the Canopy Health Network. They're the providers that have been serving our community for decades. Today, our agenda includes introduction, integrated care management, MHN, telehealth, and MyStrength. Integrated care management. At HealthNet, we believe in whole person care, that being healthy is as much about your mental and emotional health as your physical health. Mental health conditions are more common than you think, especially in times like these. In fact, 1 in 5 adults in the U.S. will experience a mental health condition in their lifetime. If you or your loved one has been struggling with your mental health, you're certainly not alone. The good news? Up to 90% of people who get professional help are able to decrease their symptoms and improve their quality of life. And HealthNet is here to help today and in the future. HealthNet has an integrated care management team of registered nurses and licensed clinical social workers who care and can help if you or a loved one need help navigating through the healthcare system during a mental or physical health setback. Our case managers will work with you and all your providers to develop a plan to help you reach your optimal level of health. Our case managers can help you cope with a new illness, whether it be physical or behavioral. They can help you gain control of new and ongoing conditions like anxiety, depression, bipolar disorder, eating disorders, or substance use disorders. They can assist with accessing available psychiatric services from therapists to higher levels of care like inpatient. They can educate and assist with coordinating autism services available for your child. They can help you find community resources to support your care. Examples of this include suicide prevention hotline, 12-step groups in your community, and the National Alliance for Mentally Ill, otherwise known as NAMI. They can help physicians and providers share and update one another with any information about your medical care. They can help you in understanding your healthcare benefits, and they can help you understand your health condition, your treatment options, and the actions that you can take to improve your health. Our behavioral health case managers will walk with you every step of the way to help you get the care that you need. Case managers are able to work with your healthcare providers, including psychiatrists, therapists, mental health facilities, and medical providers. HealthNet will partner with you to develop and execute a customized care plan that is based on your healthcare needs. Remember, please make time to take good care of yourself and your loved ones. You're important to your family. You and your family are important to HealthNet. Now I'm going to talk to you a little bit about MHN. Mental health and substance use struggles are very common problems, particularly in the current era. For example, the Centers for Disease Control report that as of June 2020, 13% of Americans reported starting or increasing substance use disorders as a way to cope with the stress and emotions related to the pandemic. MHN, which is HealthNet's Behavioral Health Division, is here to help you get the treatment and the support that you need. With a network of over 18,000 providers in California of all types, we can assist in connecting you with someone who can help. MHN's focus is on easy access to services. We have a 24/7 call center that is staffed with both knowledgeable customer service representatives and licensed behavioral health care managers, all of whom are ready to serve you. If you want to see a therapist, for example, all you need to do is call and request the type of provider you're looking for, and you'll be given the names of MHN practitioners in your area. You can see someone in person or through our large telehealth network. You don't need a referral from your doctor or an authorization from MHN in order to start seeing a provider for therapy or medication management. Just give us a call or select a provider at www.mhn.com. Our aim is to make provider access as seamless as possible. I mentioned telehealth a minute ago, and I want to tell you a little bit more about that, because having the ability to see a behavioral health practitioner without leaving your home can be really convenient. At the beginning of the pandemic, MHN recognized the need for our members to receive services outside of the normal office visit setting. As a result, we contracted with over 4,000 clinicians to provide telehealth services via a secure audio-video platform. A number of research studies have shown that telehealth is just as effective as in-person services. All you need is a smartphone, tablet, or computer to get started. MHN call center staff can answer any questions that you might have about accessing a provider through telehealth. The past year and a half has been a difficult time for all, especially those members with substance use and mental health issues. Sometimes our members need services that are more intensive than regular outpatient visits, and MHN is here to help with that as well. We offer a full range of intensive services, including hospitalization for mental health and substance use crises, day programs such as partial hospitalization and intensive outpatient, and applied behavioral analysis for the treatment of autism spectrum disorders. You can call MHN anytime and discuss your concerns with someone who can assist with finding you the care that you need. We're here to help. Another resource available to you is MyStrength, an interactive wellness platform which provides self-management and self-care tools to improve health and well-being from a mind, body, spirit perspective. MyStrength serves as a complementary or standalone digital resource to help ensure that every member has access to an evidence-based behavioral health self-management tool. MyStrength has an easy-to-use mobile app that's currently available for download on Android and Apple devices. It provides a similar look and feel that closely reflects the MyStrength web experience. The app includes mobile-optimized features that engage consumers with relevant, evidence-based behavioral health content anytime, anywhere in a fun, familiar, and engaging way. Consumers and partners can continue to take advantage of MyStrength's proven, clinically based resources through the web version of MyStrength, which is fully mobile responsive, by downloading the app or by using both seamlessly. One of the cornerstones of the MyStrength platform is its personalization to the individual user. MyStrength's recommendation engine guides individuals to tools that best support their unique mental, physical, and spiritual needs, all based on their preferences and activity history. MyStrength's interactive applications help people work toward improving the health conditions affecting so many people in the U.S., like anxiety, depression, and substance use disorders. It's also based in science with proven, evidence-based clinical approaches like cognitive behavioral therapy and mindfulness, and it's all delivered through a sleek, easy-to-use platform that only requires a login to access. MyStrength has over 16 focus areas with over 1,600 activities, ensuring that the behavioral health needs of individuals across many different clinical and non-clinical situations are addressed. Together, we drive positive change in behavioral health care through impactful partnerships. Together, we will provide meaningful behavioral health solutions to empower those we serve and help individuals live their best lives. Through innovation, expertise, and compassion, our strength allows us to deliver on our purpose to transform the health of the community, one person at a time. Thank you.